My next surrounding claim is that the MAHA movement is sabotaging the doctor-patient relationship.
Hi, doctor.
Hello,
Pleasure to meet you. Okay, so repeat your claim for me.
My claim is that the MAHA movement is sabotaging the doctor-patient relationship.
Okay, so for me, I'm going to take this back to COVID, and I don't want to stay on this topic. I had the Delta variant.
Okay.
And I went to the doctors and I told them I'm sick, got tested positive, and my doctor told me go home until you cannot breathe.
Okay.
At the same time, we didn't have any of the
Scary advice.
Yeah, we didn't have any of the monoclonal antibodies. We weren't offered any therapies where I was listening to doctors and then watching them be censored. So I think if anything damaged the doctor-patient relationship, that was it. For me, I actually had a friend run up to my house from Huntington Beach, about a 2-hour drive, brought me azithromycin, hydroxychloroquine, and ivermectin. Within 48 hours, I started to recover.
Wow, it's a lot of drugs.
Yeah, but at the same time, I think that hurt the doctor-patient relationship more than anything else.
Because your doctor sent you home without treatment?
Well, that doctor and 2 telemed doctors.
I see.
All of them. No drugs, nothing to treat what I had.
Can I ask you something about that?
Absolutely.
I'm saying that the MAHA movement is sabotaging the doctor-patient relationship. And you're talking about how the COVID pandemic sabotaged the doctor-patient relationship.
Correct.
You know what's wild? I agree with you. I think we sabotage the doctor-patient relationship.
Great.
So can we talk about how the MAHA movement's impacting it?
Well, I want to share with you what I'm going through right now. A month ago, my husband collapsed and had a brain tumor.
I'm sorry to hear that.
It's glioblastoma.
That's terrible.
And I don't want to cry.
No, why?
But,
no. Take a breath.
Yeah.
Totally acceptable to cry.
Yeah, but what I'm running into now is they want us to do standard care. Where I think as a patient, we should have the right to try. We're currently looking into Dr. Soon Shiong's trial for his bioimmunity therapy.
Okay.
He's getting treatment at Cedar, couldn't ask for better oncologists, but we cannot treat him with bioimmunity therapies until he goes through chemo and radiation, which basically, if he's not doing bioimmunity, that's going to kill both his good and bad cells. So for me, this is really personal at this point. I am looking into it, and I'm seeing the people that you want funded getting in the way of my husband's treatment, where I and my husband as a patient should have a right to try.
Correct me if I'm wrong, because I'm not an expert in oncology.
Okay.
Isn't there such thing as right to try legislation that already exists?
There is, but I don't know why. Like, for instance, it's the FDA's in the way.
But the FDA is currently run by Secretary Kennedy. So is he your enemy right now?
But see, right now...
Because then we're on the same team.
Well, but at the same time, we can also go back into Biden's administration where all the money was going into changing kids' genders.
All the money?
Well, a lot of it. A lot of that
it?
was, well, I don't know the dollar amount. But again...
Is that important?
I think that the whole industry has failed us. And I can't even go back into who's in power. What I do like about Kennedy, if we're going to stick on Kennedy, I like that for the first time I found out how dangerous this water bottle I'm drinking out of is. I like for the fact that they're taking these dyes out of food. I like that they just passed where they're going to lower the drug prices, where we end up paying the same amount as people from all over the world. These are things I like. I don't think that I've ever seen a perfect HHS secretary, and I can agree that there's things that Kennedy probably is doing that I don't agree with, but there's definitely the thing that I like about him is he's opening up other options where before I feel like everything was, you must do it by this. And again, I would like to see the FDA broken. I've been trolling Dr. Soon nonstop to the point I've gotten in touch with him, but my husband's starting chemo on Tuesday.
Yeah. That's a lot.
It's a lot.
That's a lot, yeah.
And so I just barfed all over you.
No. Look, you're the person that every time I make a video about, I think about. Every time I'm going to the hospital to work, you're the person I'm thinking about. Every time I fact check one of Secretary Kennedy's claims, you're the person I think about. You're the person I want to get accurate information, not information from Biden's secretary, not from President Trump's secretary. I don't care who's secretary. I want you to get the honest information so you can decide what's right for you and your husband. And currently, I don't feel like that's happening. And I'll explain why so you could decide if what you think I'm saying is bullshit or not. In 2024, when Secretary Kennedy was running for president, he was on stage and he talked about how GLP-1 medications, these Ozempics, Wegovy's and such, paralyze your stomach. They do these terrible things to your body. They're poisoning our nation. In Europe, they're illegal. All of that is untrue or overblown. A year later, he's standing with President Trump, celebrating that Americans are having access to these medications. How can you believe what he's saying when every time he's flip-flopping about the truth to you? When in early 2000s, he's doing interviews about mercury. He says vaccines save hundreds, millions of lives. And then now he's telling you they're a big problem and causing people death. How do you decide when he's telling the truth versus when he's not, when there's constant hypocrisy coming from him as an individual?
Well, I don't think that it's 100%. I think that there's good things and there's bad things with anybody that's in power.
I agree.
And for me, I honestly am not coming here just gung-ho. I want to learn from you. I think
That's
you
amazing.
are
I
here in
appreciate
good
that.
faith. I don't think that you're a bad man just trying to win the argument. And trust me, I've sat in this chair where that's exactly what the person in the other seat wants to do. What I would like is to see freedom for you as a doctor.
Sure.
What I would like to see is freedom for me as a patient and to be able to pursue those avenues that are best. Again, as far as Ozempic, you know what? If you eat too much ice cream, I say cut down on the ice cream. I'm not 100% behind that whole Ozempic thing because I think it's vain. I think that
What about for people who have diabetes?
Well, I think that there's better ways for them to lose weight. My ex-son-in-law has diabetes and the bad kind, and yet he drinks alcohol. You know, that's probably worse for him than anything. But I do like what Kennedy's doing as far as not
The dyes you mentioned.
the
right?
dyes and the plastics in our food, getting the pesticides out of our
so
food.
let's
thing
talk
like
about the
that.
dyes, because I think that's an interesting point. You know, a lot of people talk about red dye number 40,
Right.
that there was some research showing that kids who overconsume it have higher rates of hyperactivity and potentially tying it to ADHD. You've heard that. So that research is real. It
Right.
does exist. It's shorter term, but it does exist. So I actually think removing these petroleum-based dyes is not necessarily a bad thing. I think it's a plus side into Secretary Kennedy's agenda. However, the issues that you're talking about giving doctors a chance to be with their patients the way we're spending time together, is a systemic flaw. We don't get time with our patients. The difference between seeing a naturopath versus a primary care doctor is that the primary care doctor usually spends 5 to 10 minutes with you. And that's not because they don't like you or they don't care about you. It's the system sucks for them. So
Really-
can we get Secretary Kennedy to change the system?
Really quick, what I would like to see happen was you as a physician be able to reach across the aisle and work synergetically with other doctors that are specialists in other areas.
Sure.
For instance, with this oncology, the oncologist should work with the radiologist who should be working with
And they're not?
bioimmunity. Well, they're not allowed to work with the bioimmunity until he does radiation and chemo, which are going to destroy all of his good cells. So that's a problem. So I think as far as everything that's gone on, like for instance, you brought up the kids with the ADHD. When my son was in 3rd grade, I had a teacher who didn't like that he was a boy and hyperactive. She came to me in 3rd grade, put him on pills.
Yeah, that's rude. I'm sorry
And
that
I
happened.
said
That
no.
shouldn't happen.
And I said no. But how many kids?
And I'm not saying that shouldn't happen because no children should be on the medication.
Yeah, but
It's just,
they're putting
it's too early.
everybody
Yeah,
on it.
I will, this is another point I will succumb.
Right.
We are sometimes too quick to start medications.
Right.
And I think the reason for this needs to be evaluated.
Right.
Part of it, we have less time with our patients, so therefore we have to just do what we can. Second, we also have patients that are very consumer driven. Give me a pill to fix it as opposed to making me do the work to fix it. I don't want to patient blame, but this is the reality of what happens. So how do we fix all of these big problems without creating disconnects by cutting research budgets? Like if Secretary Kennedy
Well, I
came,
want to know where that money went because a lot
didn't
of
go
the-
anywhere.
Well, a
It
lot
just
of
got
this
cut.
money though was going to insurance companies.
the
A
research
lot-
dollars doesn't go to insurance.
Well, I would, seeing what happens in local politics, I see a lot of money laundering going on. I hate to say it.